Stop taking your blood pressure pills the same way you always have. I know your doctor handed you a prescription and said, "Take this every morning." That was it. No warnings, no fine print explained out loud. But cardiologists and pharmacists are warning about simple mistakes with these exact medications, mistakes that could be working against you right now, today. Before we go further, a quick disclaimer. The information in this video is for educational purposes only. It is not a substitute for professional medical advice. Always consult your doctor before making any changes to your health routine. If you take Amlodipine, Losartan, or Metoprolol, what you eat matters. When you take your pill matters too. Even a common supplement could change how well it works. Nearly half of all seniors are juggling 2 or more of these medications at the very same time, every single day. By the end of this video, you'll know exactly what to watch for. Maybe you take your blood pressure pill every single day, right on schedule. You never miss a dose. And still, you wonder if you're doing it right. Maybe you've had swelling in your ankles you never mentioned to your doctor, or you've wondered if that grapefruit at breakfast really matters. You're not alone in this, and you're not being paranoid. These are real gaps most people are never told about, not because your doctor doesn't care. Visits are just short, and lists are long. This video fills in exactly what usually gets left out. In the next few minutes, I'll walk you through 10 things. 10 things about Amlodipine, Losartan, and Metoprolol. Things most seniors never hear from their doctor. You'll learn what each drug does inside your body, why certain foods and supplements matter, and exactly what to watch for. Stay until the end. Number 6 could prevent a dangerous emergency room visit. This isn't guesswork. Amlodipine and Losartan are among the most prescribed blood pressure medications in the country. The American Heart Association tracks how seniors manage this condition. Nearly half of adults over 60 take 2 or more blood pressure medications together. Pharmacists and cardiologists routinely flag food and supplement interactions with these exact drugs. That's exactly why we're covering this today. Number 1. Amlodipine can cause swelling in your ankles and feet. Amlodipine belongs to a class of drugs called calcium channel blockers. It relaxes and widens your blood vessels. That's how it lowers your blood pressure. But that relaxing effect is stronger in the small vessels of your legs. It's weaker in the veins that are supposed to drain them back out. Fluid can pool low in your legs as a result. Gravity does the rest, especially by the end of a long day. Studies show this kind of swelling, called peripheral edema, is common. It affects up to 10% of people taking Amlodipine. It usually shows up in the first few weeks of treatment, and it tends to look worse in the evening than in the morning. Higher doses raise the odds of noticing it. So does standing for long periods. It's not dangerous on its own, but it's uncomfortable and worth mentioning. Some people mistake it for a heart or kidney problem instead. That's why telling your doctor matters, so they check the right cause. If you notice new swelling, don't panic, and don't stop the medication on your own. Tell your doctor or call the office. A small dose change often solves it completely. Elevating your legs in the evening can help. Compression socks can make a real difference too. Now let's move to number 2. This one involves something in your kitchen. Number 2, grapefruit and grapefruit juice don't mix well with Amlodipine. Here's why. Your liver uses an enzyme called CYP3A4. It breaks down Amlodipine at a steady, predictable rate. That enzyme keeps the drug at a safe level in your blood. Grapefruit contains natural compounds that block this exact enzyme. When that happens, Amlodipine can build up in your bloodstream. It can reach much higher levels than your doctor intended. The FDA lists calcium channel blockers among the drugs most affected by grapefruit. Too much of this drug in your system drops your blood pressure too low. That can leave you dizzy, lightheaded, or unsteady on your feet, especially when you stand up quickly from a chair. This isn't a small effect. One grapefruit can matter. It's not the same as most food and drug warnings you've heard before. Pomelo carries the same risk, so do Seville oranges, the bitter kind used in marmalade. Regular oranges and most other citrus fruits do not cause this problem. If you love grapefruit, ask your doctor or pharmacist about your dose. The effect can last for days, not just hours. Many people simply switch to oranges or apples instead. It's a small change that removes the risk completely. Number 3 is about something even more surprising. The clock on your wall. Number 3. Morning dosing is generally preferred for amlodipine. Your blood pressure naturally rises in the early morning hours. This is called the morning surge. Most heart attacks and strokes happen right around this exact window. Taking amlodipine in the morning helps it reach steady levels early. That way, it's working hardest right when that surge tends to happen. Some newer research on other blood pressure drug classes explores nighttime dosing, but for amlodipine specifically, most cardiologists still recommend a morning routine. A consistent time matters more than most people realize. Taking it at random times, some days morning and some days night, weakens its effect. Your body responds best to a predictable rhythm, day after day. A pill organizer or a phone alarm can make this far easier to keep up. Pick a time you'll remember every single day. Right after breakfast works well for many seniors. Consistency matters more than the exact hour. Ask your doctor if your combination of medications changes this advice. Now let's shift to a medication that works in a completely different way. Number 4. Losartan doesn't mix safely with potassium supplements. The same goes for salt substitutes. Losartan belongs to a class of drugs called ARBs. That stands for angiotensin receptor blockers. It works by blocking a hormone that narrows your blood vessels. As a side effect, it also changes how your kidneys handle potassium. Your kidneys hold on to more of it than usual. Potassium supplements add even more on top of that. So do salt substitutes made with potassium chloride instead of table salt. Together, they can push your potassium levels dangerously high. This condition is called hyperkalemia. It can cause a dangerous, irregular heartbeat. In serious cases, it can disrupt your heart's rhythm altogether. Bananas, oranges, and potatoes are also naturally high in potassium. You don't need to avoid these foods completely. But combining several high potassium sources with losartan adds up quietly, meal after meal. Most seniors have never been warned about this specific combination. Check the label on any salt substitute in your kitchen. Many say potassium chloride right on the front. Never start a potassium supplement without asking your doctor first. Request a potassium blood test if it's been over a year. Number 5 is actually good news for many of you. Number 5. Losartan can actually protect your kidneys if you have diabetes. High pressure inside your kidney's tiny filtering units causes damage over time. That damage happens faster when diabetes is part of the picture. Losartan doesn't just lower blood pressure throughout your whole body, it specifically eases pressure inside those small kidney filters. Doctors call these tiny filters nephrons. Large clinical trials have looked closely at this exact effect. They show losartan slows kidney damage in people with type 2 diabetes. That protective effect goes beyond blood pressure control alone. It's one of the main reasons doctors reach for losartan first in diabetic patients, rather than choosing a different blood pressure drug with no kidney benefit. This doesn't mean every diabetic needs losartan specifically, but it's a conversation worth having, especially if kidney numbers haven't been checked recently. If you have diabetes and high blood pressure, ask your doctor about this. Find out if losartan fits your kidney protection plan too. An annual urine test for protein can track your progress over time. We still have 5 more things to cover. Number 6 is the one that sends people to the emergency room. Please don't skip this one. Number 6, never stop metoprolol suddenly, even if you feel completely fine. Metoprolol is a beta blocker. It blocks adrenaline's effect on your heart. That slows your heart rate and lowers your blood pressure over time. Your body adjusts to this by growing more receptors. All of them sit there waiting for adrenaline. Stop the drug suddenly, and those extra receptors get flooded all at once. This can cause a dangerous rebound effect. A sudden spike in blood pressure, a racing heart, chest pain can follow. In serious cases, this rebound can trigger a heart attack. This isn't rare. It happens when prescriptions run out unexpectedly. It happens during hospital stays, when medication lists get mixed up. It happens when someone feels better and assumes they no longer need it. None of those situations are safe reasons to stop on your own. Any change to metoprolol must be tapered gradually, over 1 to 2 weeks, not all at once. Never let yourself run out without a refill plan. If you're ever hospitalized, tell every doctor and nurse that you take it. Let's move to number 7. Something that affects nearly half of you watching. Number 7. Nearly half of all seniors take 2 or more of these at once. The American Heart Association tracked how adults over 60 manage their blood pressure. About 47% use more than one medication together. This is often necessary, not a mistake. Different medications lower pressure through different pathways in the body. Combining lower doses of 2 drugs can work better than one high dose. But it also means more chances for side effects to stack up. It means more chances for a dangerous interaction to slip through, especially when different doctors prescribe different parts of your regimen. A cardiologist adds one medication, a primary doctor adds another. Nobody always sees the complete list at the same time, except you. Bring every medication and supplement bottle to your next appointment. Ask your pharmacist for a full medication review. This one step catches interactions a rushed visit can miss. Number 8 involves a medication that often gets paired with these 2. Number 8, diuretics are often paired with these drugs, and that adds another layer of complexity. A common diuretic called hydrochlorothiazide is frequently prescribed alongside them. It helps your body release excess fluid and sodium through your kidneys. But unlike losartan, this diuretic works the opposite way on potassium. It can cause your body to lose potassium instead of holding on to it. Combine a potassium-retaining drug with a potassium-losing one, and something interesting happens. The 2 can actually balance each other out, but that balance only holds up under careful, regular monitoring. Skip a dose of one drug but not the other, and that balance can tip. Dehydration from heat, illness, or reduced fluid intake can tip it too. This is exactly the kind of interaction a routine visit can miss. Ask specifically which of your medications raise potassium and which ones lower it instead. Your doctor should check your potassium and kidney function at least once a year. Number 9 is about a feeling many of you already know well. Number 9, dizziness when you stand up quickly is common with these drugs. And for seniors, it raises the risk of a serious fall. This is called orthostatic hypotension. When you stand, gravity pulls blood down toward your legs. Your body normally tightens blood vessels quickly to keep pressure steady. That keeps enough blood flowing to your brain. Blood pressure medications can blunt that natural reflex, especially right after you take a dose. Age-related changes in circulation make this even more likely. Even a few seconds of unsteadiness can lead to a serious fall. A hip fracture, a head injury, things that change independence overnight. This risk is often worse first thing in the morning. It's also worse after a hot shower or a large meal. Dehydration makes it more likely too, so drinking enough water throughout the day helps. Sit at the edge of the bed for a few seconds first. Stand slowly, holding on to something sturdy if needed. Tell your doctor if this happens often. Your timing may need a small adjustment. One more thing to cover, and it ties everything together. Number 10. An annual pharmacist medication review can catch what visits miss. Doctors have limited time in a typical visit. Blood pressure medications are often just one part of a much longer list. Pharmacists are trained specifically to spot food interactions. They catch supplement conflicts and dangerous combinations too. They can look across your entire medication list at once, not just one prescription at a time, the way a quick visit might. Many pharmacies offer this kind of review completely free of charge. Medicare also covers a formal medication review for people who qualify. It typically takes less than an hour, and it's often done sitting down together. Many seniors are surprised how much it uncovers. Old prescriptions they'd forgotten about, supplements bought on a whim, things nobody had connected to their blood pressure medications before. Once a year, gather every prescription, over-the-counter medication, and supplement you take. Ask your pharmacist for a full review, not just a quick refill. Mention Amlodipine, Losartan, or Metoprolol by name. Let's bring these 10 things together. Amlodipine relaxes your blood vessels, but watch for ankle swelling. Skip the grapefruit and take it consistently each morning. Losartan protects your blood vessels and your kidneys too. But be careful with potassium supplements and salt substitutes. Metoprolol slows your heart down safely, but it must never be stopped abruptly, no matter how good you feel. And nearly half of seniors are managing 2 or more of these together. A full review of everything you take matters more than ever. None of this means your medication is working against you. It means a few small habits can help it work even better. Before you go, I want to ask you something. Are you currently taking Amlodipine, Losartan, or Metoprolol? Tell me in the comments below. I read every single comment, and I'll reply to as many as I can. Your experience might be exactly what someone else needs to hear today. If this video helped you, please share it with someone managing their blood pressure. A spouse, a sibling, a close friend. Most seniors never hear these details in a rushed appointment, but not the ones who watch this channel. And if you haven't subscribed yet, now is a great time. We cover topics like this every week. Next, we're talking about the everyday foods quietly raising your blood pressure, and the ones that bring it back down naturally. You don't want to miss that one.